Hello, multi-sport community. Brittney Doran, athletic trainer, coming from Head to Toe Spine and Sports Therapy. Today I want to talk to you guys about foam rolling. Just really the basics. For those of you that already have a foam roller and maybe don't use it, or don't know why or how to use it. Basically, the great thing about a foam roller is that it allows you to help yourself at home, either prevent or help treat the injuries that you have. I think the most ideal way to use a foam roller is with the prevention in mind. So even if you're not hurt, you can use a foam roller before your workout to get looser and have more mobility. You can use it after your workout to treat those tight muscles, to decrease your late onset muscle soreness. That happens about 36 to 72 hours later. It's also something that you can help prevent injuries, because one of the biggest things about endurance athletes is that every day things build. Just like you're training, with every run you get better, but also tension, adhesion, scar tissue, those all build slowly over time also within your muscles. It's kind of like you're building a mountain slowly, and then when the mountain gets heavy enough, your musculoskeletal system can't support it anymore. And that's when you get pain that seems to come out of nowhere. Oh, it was just a little bit tight and now I can't walk. That's how those things happen. So the great thing about a foam roller is that as that mountain of tension is building with every training session you do, the foam roller can help take that down a little bit. So you're always going to have some strain, tension, adhesions, knots in your muscles. But if you can keep them down to a minimal level, your muscles will be able to still function and decrease injury. So when I use a foam roller, I use it if I feel tight. I'll use it before my workouts, or if I know I have an issue that I need to work on. If I know I'm tight in an area, and I know I've done a hard workout using that area, then I'll use it. I'll make sure to use it afterwards. But I'll also just use it on my day off. I'll just get on a foam roller, and one of the great things about foam rollers is that they'll tell you where you're having issues. If you get on a foam roller and you do one arm and one lat and it feels like nothing, and you go to the other side and it is horrible shooting pain, you've probably got something building there that maybe you didn't even know yet, but eventually your body would tell you that it is. But you can get on it early knowing that it's there. A couple things for especially runners, cyclists, that we see most often that cause issues, areas that you should foam roll on a regular basis, whether you think you need to or not, are quadriceps, so the front of the thigh, low back itself, the upper back, getting extension through your thoracic spine, and then also, like I just said, the lat and underneath the armpit here. Those are probably, and actually the calf too. So I would probably take those 5, and those are the ones that I would do every chance that I get. Now, how often do you foam roll? I know that sounds like a lot of areas to do all at once. I like to pick areas and work on them. So what you can do, especially if you already have your training routine set out, is maybe you can pair things up and go, okay, when I swim, I'm going to make sure to roll my shoulders afterwards. When I run, I'm going to make sure to roll my quads. When I cycle, I'm going to make sure to do my calves, or some sort of combination like that. And all you really need is 5-10 minutes before/after your activity to take down any tension and any scar tissue. The great thing about foam rollers, it's hard to overdo, so I've yet to tell anyone you're doing too much. So it's something you can do when you're having just your downtime. When you're watching TV, when you're talking to your spouse, kind of combine it into the time that you would be just sitting and stretching. It's something that I think is a good combination with coordinated stretching, but also I think foam rolling your quads is more effective than just sitting and stretching them. So I might, instead of stretching now, start foam rolling. You can get short foam rollers, smaller ones that are easier to take with you when you're going places or throw in your car. If you really can't bring a foam roller with you, say you're traveling to a race, a lacrosse ball is a good alternative. It's small, and then you can really get specific on the muscle that you want to work. One of the other things that people always ask me about is they say that, well, sometimes it hurts to foam roll. Is that normal? And my answer is sort of. If any of you have had active release technique in our clinic, then you'll know kind of what I'm talking about when I say that it should be a good hurt. It should be like when you have a knot in your muscle and you push on it and it hurts, but it feels really good at the same time and you know it's what you need. That's the feeling you should get. It should feel like you're rubbing a sore muscle. If you have sore muscles and you massage them, that sore pain, but it's good and you know you need it, again, that's what it should feel like on the foam roller. The one danger from a foam roller is that you should not be rolling over bone directly. And actually that is more applicable to the lower extremity than it is the upper. When you go up into your upper back and your shoulder, you kind of can't avoid rolling over some bone, which is fine, but you don't want to be putting extra pressure on top of the bone. I don't need to roll the corner of my scapula. It's a bone, it's not going to go anywhere. But it is dangerous more so when you get into the lower extremity. So on the SI joint and the low back, there's really nothing between the bone and the skin, and so if you roll over that bone, you can irritate it. The outermost lateral hip bone, where a lot of people get bursitis, you can get bursitis there by rolling over that bone and irritating that bursa. Obviously, things like the kneecap, the shin bone in the front, those are not areas you need to roll. It's not going to do you any good, and it's actually probably going to irritate if you do that too much. All right, there are some basic things for you to use with your foam roller. Pay attention for more to come.